Hello! Well, welcome to the inaugural episode of Exploring Ethics Across Medicine. We're your hosts today, me, Annika Mazika. I'm a fourth-year student at Arizona State University, majoring in biochemistry and minoring in nonprofit leadership and management, with the hopes of going to medical school and one day becoming either a pediatrician or some other kind of PCP. And for today's episode, our guest is...
Hi guys, my name is Sophie. I am also a senior at Arizona State. I currently study chemical engineering, where I also have the hopes of going to medical school to become a pediatrician in the future.
And we love it. We're going to big brain our way through it. But on that note, the topic of today's episode is clinical ethics consultations in Seattle Pediatrics, specifically a little study done at a specific hospital. So imagine walking into a pediatric hospital with your child in tow for concern they may have something severely affecting their health, whether that's a physical illness or an emergency or potentially a mental illness such as an eating disorder. After being seen by the doctor, they recommend you to a clinical ethics consultation in regard to deciding treatment. How would you feel if you knew that there was a disproportionate rate to these recommendations based on race and or insurance coverage? Are these physicians targeting you? Do they not trust the patient's decision? Or are they doing it to provide the most knowledge in regards to care? Let's dive into it. Today we will be exploring this ethical dilemma by evaluating the case presented to us by Zaid Jalani via News Nation in an article titled Study Finds Potential Disparities in Pediatric Ethics Consultations. Jalani reports that through recent research regarding clinical ethics consultation, also known as CECs from this point forward, at a pediatrics hospital in Seattle, it was found that there was a disproportionate rate of CEC recommendations based on patients' race and insurance coverage. The main ethical dilemma posed is the background of why this is happening. Is there pediatrician bias regarding these populations, or is there a need to delve further into these topics for those populations to keep them properly informed about their care? The study, with the lead author, Alexandra Olszewski, in performance with her colleagues, found Black patients and patients with no insurance or public insurance were much more likely to be recommended a consult. It's important to note that CECs are meant to advise patients, their families, and the associated healthcare workers in identifying, expanding on, and hopefully resolving any ethical dilemma that presents during care. At the Seattle Hospital, a main use is how to ethically navigate care plans for their patients. In terms of why people may need the consults, one example posed by Olszewski is for teenagers with eating disorders who may need to find out whether that patient is able to make a decision in that situation. So they bring in an ethics consult to kind of go over it with the patient and the family. But reasons why this may be happening at these high rates at the Seattle Hospital include a few reasons. For starters, patients might not know that these consultations exist, and they might just be getting these recommendations and kind of learning about it along the way. Additionally, this is done to hopefully erase any barriers to proper ethical healthcare, as it is a way of keeping patients informed of not just what is going on, but the ethics behind it at every stage of care. However, it may be also important to explore the potential bias and prejudice that could be occurring based on a patient's race or economic status. Physicians may also want to be in control of the decisions more than the patients. But Olszewski maintains that these consultations are important, but the high referral number may throw outsiders off if they are looking at the situation through a narrow viewpoint. Are pediatricians limiting care and discriminating? Or are they trying to offer the best and most informed care to all the patients? Olszewski also states how these recommendations are made is vital to eliminate any seemingly potential bias or prejudice, as the way we frame it is going to help us kind of get through it. But yeah, join us as we explore the ethics of, funnily enough, the CECs themselves. But before we begin our discussion, the word of the episode brought to you via Morrison and Furlong's book, Healthcare Ethics, Critical Issues for the 21st Century, 4th edition, is justice. Justice follows the notion that relevant parties should be fairly treated from the procedures that are followed to the resources shared. One important division of justice relevant is distributive justice, which is the specific allocation of resources among the population with the patterns of distribution varying for different circumstances. All right, and one more thing important to note before we dive right into it is a couple things from the AMA, the American Medical Association themselves. In their code of ethics, one key thing is how, our disparities in healthcare. So, verbatim from the website are stereotypes, prejudice, or bias based on gender expectations or and other arbitrary evaluations of any individual can manifest in a variety of subtle ways. Differences in treatment that are not directly related to differences in individual patients' clinical needs or preferences constitute inappropriate variations in healthcare. Such variations may contribute to health outcomes that are considerably worse in members of some populations than those of members of majority populations. So with that, a couple of their expectations for physicians are to provide care that meets patient needs and respects patient preferences, avoid stereotyping patients, examining their own practices to ensure that inappropriate considerations about race, gender identity, sexual orientation, socio-demographic factors, or other non-clinical factors do not affect clinical judgment, and to work to eliminate biased behavior toward patients by other healthcare professionals and staff when coming into contact with these patients, to encourage shared decision-making and cultivate effective communication and trust by seeking to better understand factors that can influence patients' healthcare decisions, such as culture, traditions, health beliefs, and health literacy, language, or other barriers to communication and fears or misperceptions about the healthcare system. So on that note, now that we've covered the article, Sophie, what do you think about this?
Yeah, thank you for covering that, Annika. Somehow I can't seem to think about the patients themselves. How would they feel if their doctor or pediatrician kind of brought them over to an ethical consult? Maybe the patient's feeling, oh, is this pediatrician not enough? Or are they not knowledgeable enough to provide me the options I need? Are they not capable of guiding me to the right option without seeking outside help? Maybe they can also think, oh, will this be an extra cost having to see an extra person or having an extra person involved in the case, which most likely usually will be. I feel that while ethical consults can be a great option for very extremely complicated cases, such as what you pointed out, eating disorders and potentially some other issues, such as maybe child abuse, there comes a worry about, okay, when do we need an ethical consult? When is it considered overkill in terms of the burdens of financial healthcare? And then, moreover, why do we see it more in, as you listed, those who are of a different race, have public or low insurance? I think it's important to consider that on the other side, of course, there are physicians who might not truly be knowledgeable in helping those patient populations. And having an extra consult, having an extra set of eyes is important to help those physicians ensure that they're considering patients' autonomy and keeping the patient's health in mind in first, while navigating the financial and accessibility barriers in place in the healthcare system, which can lead to existing ethical issues.
Well, thank you, Sophie. That was a very thorough response. You brought up some like amazing points. For starters, I didn't even think about how, from a patient perspective, that kind of recommending this might kind of bring into to consideration, like, are they really like qualified? Like, why do we need this extra step? And especially like as you said, like, is it more expensive for that extra step? Um, great points. And but on the other hand, for that, I think it's also important that it's patient centered care. So keeping the patient in mind through every decision and every making or every recommendation is going to be really important. So if a physician feels like this is really going to benefit the patient, and maybe like I can inform them on like the procedure side, but I don't know if I could do like justice, like bringing like the ethical side. I think it might be important to bring in those like kind of specialists in the sense, so the patient is getting everything that they need to make proper decisions, and if there is a dilemma, that they can know all the information around it and like see, okay, where are we going from here?
Mm-hmm. You do bring up a lot of great points. Yeah.
Okay.
Yeah, you bring up a lot of great points. But I feel if the ethical consult is such a great benefit to certain patient cases, why don't we use them everywhere? There's going to be issues with resource allocation. Maybe there's just not enough ethical consults or consultants to be able to provide that service to every single patient. And so we need to develop a systematic way of determining when it's the best option to bring in a consult that doesn't necessarily utilize or, I guess, um, discriminates or uses race or financial barriers as the reason why they bring in more consults or they have more consults.
Yeah, I mean, you bring up a great point. I was just about to bring that up is the distributive justice aspect. Like, like is justice made to be fair? Because, it might be important to note, like, the goal is to get as, like, equal as we can of a playing field. But there's certain situations that, like different resources and recommendations and like like treatments itself need to be like brought out for different reasons, and discrimination might be like an appropriate thing to do, not necessarily like a bad discrimination, but like a sound, like, what, how are we defining this, how are we going to set this out. But I just wanted to know, like, do you think this is one of the cases where that really applies?
From what it seems, I definitely think there are a lot of existing healthcare barriers to patients of color and patients who are from lower socioeconomic classes. I mean, we see it with access to, access to healthcare. They don't necessarily have the transportation resources to make it to the hospital.
Mm-hmm.
Knowledge. They don't necessarily have the resources or help to understand the complicated healthcare system and insurance policies. So I can definitely see the benefit of adding an ethical consult to help these patient populations that have these existing barriers in place that prevent them from getting healthier faster and easier and quicker. But definitely, you do bring up great points with distributive justice, using that as a basis of trying to provide a consultation to help these patients. However, I do think it's important that physicians are trained in these ethical cases to kind of lower the need to have an extra set of eyes and having that barrier, because sometimes maybe you have to wait a long time to get an ethical consult. I think it's also important to make sure our physicians are trained to provide that another set of eyes when they necessarily don't have the resources to get a consult.
I agree. It is really important that the physicians have their own, like, keep it in line with their ethical code of standards. So, maybe they can avoid that in the future. And, but, not to play devil's advocate. uh, but no, like I said, with like the specialists, it might be important to bring them in. And, but also, in terms of like why we might be kind of adverse to like that number, like the disproportionate rate, is like, is there bias? So like, it might be important to bring in that extra pair of eyes, so they're not involved in the care necessarily, like they're informing the decisions, and they're kind of informing, like kind of evaluating the background, like, are we capable of making decisions? What are the ethical things behind each procedure, and like, how are we going about it? But they're not directly involved. So I think it's a good source to like maintain patients' autonomy, because we're keeping them informed, but we're not forcing them, and we're kind of giving them like another perspective, I guess, like offering that to keep them super
Yeah.
informed about everything.
Yeah, I know the article also like pointed out, however, on the flip side, that the consults could be a way of pressuring or fear mongering those patients
Yeah.
to say yes to the physician's chosen treatment plan. So I think it's important to recognize, who are these ethical consults for? Are they in particular for the physician so they can navigate the ethically complex case, or are they for the patients to understand the ethics behind the case? So I think it's important to recognize what roles the ethicist is supposed to play, and the possibility of the ethicist to being of course, having internal bias themselves. We're all fallible, we're all human. So there's what right does this one person have to be the end all be all for ethics?
That's true. But on that note, it's important to note, like, how is it being framed? Like you said, like the why behind it makes a difference. Like, who is it for? So once you know who it is for, like, how are we going to tell patients, like, I think we should do this because of this. This is why it's going to be beneficial to you. There's not going to be like risks involved, kind of getting that beneficence and non-maleficence involved. But it's important, like, how it's framed, and like kind of in the article, Jelani, like, kind of like going over it, like Olszewski kind of covers that at the end. That's how it's like the seemingly like biased nature is going to kind of get eliminated.
Mm-hmm. Yeah, I think it's just complicated, just overall, how humans are biased in general, and just the financial implications of having an ethical consult. Is that more expensive? But then also the article does say that maybe it's a method of discharge, getting the patients out of there faster,
Yeah, that's
having
true.
someone else to deal with it so the physician can handle other cases. It's all very complicated. And I do think at its core, the consults are a great idea to help patients navigate a difficult and scary time, frankly. But we also need to be aware of the limitations of humans themselves in providing objective advice when all of these are cases where there's no right or wrong answer.
I totally agree. Yeah, just kind of wrap it up again, like I said, like kind of framing it, like, it's going to be complicated, but what are we doing? Who are we talking to? And like, how are we doing it in a way that's beneficial to the patient without being pressuring?
Mm-hmm.
But yeah,
Yeah.
well, any final thoughts on this topic?
Well, overall, I'd say great idea in theory, and hopefully, while there are some limitations of it, hopefully we'll see more consults in the future.
I agree. And my final thoughts are, I think it's a great idea. The more information, the better. That's how I run by things. Um, but the biggest thing is, like, how are we implementing it? That's gonna be the most beneficial way to both the patients and the providers.
Yeah.
But on that note, thank you so much for joining us, Sophie. What a fun discussion.
For
This is super
inviting
interesting.
me.
Yeah. You offered some really great points. Like I said, like, I did not think about some of them, like what, like, at a patient perspective, like, oh man, like, does this guy know what he's talking about? But no. But very fun discussion. Thank you for joining me. I had a great time.
Thank you.
But for anyone listening, the resources, including the article, the AMA Code of Ethics cited, and any other things mentioned, will be in the description if you want to kind of look at that and kind of read it on your own. And yeah, if you want to share any thoughts, please feel free to, and we'll see you in the next episode. Bye!